Welcome everyone to today's webinar. I am Aaliyah Pavela, reporter with Becker's Healthcare. We will begin today's webinar with a presentation and we'll have time at the end for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Also, throughout today's webinar, we will have a few poll questions for the audience. The poll questions will pop up directly on your screen, and then you can select your answer from the options and click Submit. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to start today's webinar by introducing our presenter. Dr. Call currently serves as Senior Vice President of Avius, a division of MedDecision. Prior to the role at MedDecision, Dr. Call served as National Director of Population Health Account Management for Catholic Health Initiatives with leadership responsibility for value-based payment programs and operations. Dr. Call also serves as adjunct faculty for the MHA program for the University of Arkansas Fort Smith, teaching health policy and organizational behavior courses. Dr. Call holds a doctorate degree in health administration from the Medical University of South Carolina and a master's and bachelor's degree in social work. Dr. Call's dissertation focused on the effectiveness of bundled payment care models and is a recognized national speaker on population health. Dr. Call's passions are healthcare innovation and transformation, care redesign, and value-based care models. Dr. Call, I'll now turn the floor over to you.
Okay, thank you so much, Aaliyah, and welcome to everyone that took time to dial in today and participate in our presentation. We're so excited to have you here and talk about this topic that I'm very passionate about. So today we'll spend about 45 minutes and leave plenty of time for questions covering the topic of a strategic roadmap for value-based success. We'll focus in on bundle payment models, but we'll also be covering other topics throughout the presentation as well. So I look forward to the conversation and the questions as we wrap up today. So the key areas of focus for this session, we really wanted to try to make this session a practical tip session for you. We have a variety of participants on the line. Some of you are very new to value-based payment models, and some of you have expertise in these models. So we'll try to cover focus areas that will apply to all of you, and I look forward to your contributions as well. We'll look at the models, BPCI and BPCI Advanced. We'll compare and contrast what we see as similar and different in some strategies to be successful, and focus a lot of time on how you can use your existing care redesign efforts, whether you are part of a health system or a payer system or physician model, how you can use the efforts that you've already been working on and launch them into a scalable model for success. We will share some lessons learned through research and through on-the-ground work with clients who have participated in these models and been successful and plan to move on to the BPCI Advanced model as well. And we'll spend some time talking about partnerships and the critical success factors of the relationships that you will need as you move toward value-based care and into looking at a longitudinal patient view. So as we get started and we jump in here, really wanted to level set the topic. We know as healthcare continues to shift from fee-for-service to value-based care that our payers are embracing these new models of care, specifically bundle payment models, as a way to reduce costs and drive improvements in quality. So we're seeing more and more payers launch into these models. We also know from our learnings and our work in this space for several years now that at the center of all of these value-based care models, whether it's bundles or other patient-centered medical home models or accountable care models, that there is a requirement for providers to collaborate and coordinate care across the entire care continuum, which is something that is difficult to achieve without an intense focus on a strategic roadmap. So we'll talk about that today. What we've seen is that if you can leverage your efforts in the work that you've already done as part of your organization around improving the care that you provide, that you will have a jump start in these new bundle care models. So really want to focus in and talk some about not making this too hard. A lot of organizations are start with a very complex strategy around value-based care, and often you can achieve success with a much easier strategy in the beginning. And again, we know that all of our organizations have been moving to improve care, so we want you to be able to use the work that you've done in those areas instead of starting from scratch. So we'll talk about how you can tap in to some of the work that you've already achieved so far. Want to let you know, you heard in my introduction that I am part of AVIUS, the division of MedDecision. AVIUS is an organization that provides strategic, operational, and implementation consulting and advising services for our clients that are on their population health journey. Some of them very early in their journey, some very expert in their journey. So we get the pleasure of working with our clients as they move toward these new models of care, helping them with best practices and changing the way that they go about innovating healthcare. We're going to take our first audience poll question here. The team will launch that question to you, and I'll give you a moment to answer that. So the question you should be seeing on your end is thinking about where you are today. Do you have care redesign efforts you could consider evolving to build a foundation for bundle payments? We'll give you just a few seconds to log your answer in there. Leah and Margot, do you have the results on your end that you can share, or will they pop up here for us? All right. Thank you for your participation in our poll. That helps us give a little bit of a level set of where everyone is, so we appreciate you sharing that information with us. I want to dive in and talk about these models in more detail and level set. I know that Becker's and others have put on a variety of workshops specific to the BPCI advanced model, and so I don't want to spend a lot of time in the weeds of the model, but spend more of our time today on your strategy and some tips on how to help you succeed. But I do want to level set here about the key details that we just want to keep in mind as we're moving toward these kinds of models. As we know now, a lot of payers are entering into this space, so it's not just Medicare that is working in this area. We see Medicaid providers, commercial payers, and employers also entering into this space. So there's been a lot of growth in these models. Typically, these models are designed around a clinical episode of care, and that will be the starting point and the focus as you help across the continuum for this particular episode of care. Typically, we're seeing most of these models gravitate toward a 90-day episode of care, starting upon an admission to a hospital setting, although the advanced model is also going to include an outpatient admission for the first time, and then continue through the post-discharge period. Accountability is shifting some in these models, and I'll talk about the difference. We did see one mandatory model come out. We're now seeing most of these models, again, seem to be gravitating more toward voluntary models to increase participation by the healthcare community. The risk models are typically up and downside financial risk, and Medicare would like to try to see us gravitate and be more risk-taking with some of their models, but we're still slow uptaking toward financial risk in most of these value-based programs. The savings is there for teams that can come under their predetermined target pricing, and then of course also you have the ability to achieve additional savings as you work to redesign your care and achieve internal cost savings at your organization. These are complex programs and typically need to be woven in to other work that you're doing in your organizations. And so because of that complexity, we're seeing a lot of organizations enlist the help of consultants that have expertise in this area to help them achieve success on day one instead of trying to work on these models alone. So just some key things about Advanced I wanted to point out, because it does show some movement at the Innovation Center for changes that we might see in the future with other value-based models that they start to launch. This is a voluntary model, as I mentioned. The hope there is that they will see a lot of participants in this new model, and did a very large campaign to try to get participants to apply for this model. This is a care redesign model, and the focus of all of the value-based models that Medicare and other payers have put out so far have stressed the importance and the need to adopt best practices and reduce variation by improving your care delivery, while you're, of course, reducing costs. But the redesign of the care delivery is still a focus of this model. It's called out in many different ways in the details of what the Innovation Center would like for you to focus on if you participate in this work. It is a retrospective bundle, as we have seen with the other programs, and it will be a 90-day episode of care, as we've seen in some of their other programs. For the first time, they're introducing the concept of applying a bundled model for an outpatient episode of care, with the launching here of 3 outpatient clinical areas that you can focus on. So this will be new learning. I encourage you, if you plan to participate in innovation with these kinds of models, that you stretch yourself to apply and participate in not only the inpatient model, but also look at one of these outpatient areas and try to challenge yourself to redesign and do things differently in that area also. This will qualify as an advanced APM model, which the BPCI model did not. So they really worked hard on this at the Innovation Center to get a bundled payment model that would meet that criteria to give physicians this opportunity, really stressing that the Innovation Center is acutely aware that for the success of these kinds of models, you will need physician participation and coordination and collaboration. So they're really trying to step this up so that we can see more physicians want to engage in this work as well. It will be tied to quality, and not surprising, I will briefly show the quality measures, but Not surprising, Medicare is tying these to the standard quality measures that they already require our healthcare providers to report on, because that data is already there. It's already reportable. It should make it easier for you to send the data, but also for them to collect and standardize the results, which is what they're hoping for. It will involve a target price, as in their other models, that you will be working toward. And the model participation is slated to begin on October 1st and running through 2023. The Innovation Center has already announced that they will provide a second application period if any of you on the line did not decide to participate in round one, that they will provide a second opportunity in 2020. So if you're listening to gain some expertise and prepare for later, you will have that opportunity. These are the standardized quality measures I mentioned. There's several of them there, as you can see. The comment I would have here about quality measures in all of these value-based programs is the research, and I'll share some research at the end of this presentation, has been slow to show improvement in quality. There has not been a decline in quality as a result of these models that has been proven by research. But what the researchers would like to see is that we're showing a significant increase in quality as a result of us working together on these kinds of models. And so these are the ones that they'll be keeping their eye on as we go forward with this program. So I want to talk a little bit about some practical tips for you, for organizations that are looking to jump into this model. There's some steps that you can be taking to prepare yourself. And so I want to just give you some things to think on here as you start to gather your teams together to work differently. Of course, you want to evaluate the opportunity and the risk areas for your particular organization, whether it's a health system, physician practice, wherever you're practicing healthcare. You know, where are the opportunity areas? Where do you feel like you have some risk that you'd like to focus on improvements in? A lot of the teams that we work with already have ongoing care redesign efforts for one reason or the other. It could be as a result of a mandated program. It could be the result of penalties that they're paying. So they're focusing already in a particular care area. So encourage your teams to look for where are you already spending time and resource and activity, and is there a possibility to align that work with this new kind of model? Typically, the work that you're doing for care redesign is a lot of the same work that you would need to do as you start to enter into one of these new models of care. So start to look around your organization and see where work is already happening that you perhaps can repurpose to be part of this kind of program. It's really critical for you to identify physician leaders that will be able to work with your teams and be passionate about the areas that you would like to focus in. And so I'll spend a second here because I think it's really important. We oftentimes will pick physician leaders for these kinds of programs that are the leader of the particular service line that we have an effort underway in. So if we're working, for example, in a surgical area of joint replacement, we would pick the joint replacement lead for that area. A lot of physician leaders in the organizations that will be the most passionate about this kind of innovation perhaps are not that person. So I encourage you to think out of the box about leaders who can really be open-minded and think about innovation differently, and also think about how you can change care outside of your organizations. Those are the leaders that will be the best champions for this work for you. Make sure that you have a strategy in place and you start to develop a post-acute partnership in your communities. And when I say communities, it could be a large community based on how you serve. A lot of people serve a very large community base. Sometimes it's an entire state. You have to start to look at post-acute pathways and areas where you will experience risk if you do not have partnerships and pathways agreed upon with your partners. So identifying who those partners are and engaging them in a formal way to come on this journey with you to co-create new pathways of care and new ways of delivering post-acute services will be critical to your success. Make sure to take a look at your staffing and your infrastructure needs and identify partners. Again, it could be inside your organization you already have work going on that you can tag this project onto and redesign some of your staffing to support this work in a different way. And always one thing that's typically overlooked is that there will be infrastructure needs in these kinds of models for data and tools for your operation team to understand how the program is running and where you are achieving success. So we're going to do a second audience poll question, and you'll see it just like you did last time on your screen. And the question we're interested in here is this one. Some provider organizations are beginning to participate in bundle payment opportunities with payers. Have you collaborated with an outside organization in this way? Is our second question. All right, thank you for your feedback there. We appreciate you guys participating in those questions for us. So we're going to dive in now to some practical tips that I hope you can take and start utilizing immediately, really was the goal of us putting this together in this way. The real problem that a lot of organizations face is how to not reinvent the wheel when they start to enter into these kinds of models. And typically, organizations are concerned about their bandwidth. So just want to focus in here and talk a little bit about the fact that many of you have already implemented some care redesign activities. And the good news is that's exactly where you should start when you're looking at these new kinds of models and really start to think about the journey that you are about to take as you go down this path. We really want teams to think about building a foundation for these kinds of activities versus building a foundation for one model of care. And just, for example, building a model of staffing and infrastructure and partnerships that only would be utilized if you were to participate in the BPCI advanced model. We'd rather you think about how can I build a population health foundation that would support whatever programs the organization goes on during your journey. And often bundles is just a start to the work that teams do, and then they move past that into more complex and more robust programs. So really want to think about how to get some scale as you start down this pathway, how you can utilize the work that you've done and then use the new information that you will gain as part of these kinds of models to add on to. So as you consider moving into this space, of course, you will have access to data that you have not had before. So as a result of these kinds of payer-sponsored models, the payer is going to give you data that will begin to enlighten you on how your patients travel in the care continuum and what happens to them at every step of the way in that journey. So as you have that data, you and your team will immediately start to spot some key areas of opportunity that you would not be able to uncover without this data that truly shows you the entire picture of care versus the picture of care only at your organization. So this will be a key difference for you as you see that data and begin to look at opportunities that your team can impact. So I encourage you as you review that data to leverage your team effort, and this is a team sport. There definitely is no way that you will be able to be successful without leveraging a team around this work. So as you get your team together in a room, in a working session, I would encourage you to have that team as a patient travel whatever specific clinical journey that you are working to improve upon. So for example, if you are going to work in the area of joint replacement, you would have this team start on that journey and actually plot out every step of the journey, document everything that happens in every part of the journey, and begin to identify gaps in your current workflow. And that would need to be addressed for you to revise your pathways and be successful in this kind of at-risk model. What you'll start to see is that there are handoffs and opportunities for your team to make key decisions that will be critical for you to be successful. But they need to plot it all out in detail and start to be brutally honest with each other about where the gaps are, and then how do you close those gaps. So that's one part of what your team will focus on as you start to work in this program. You really want to challenge your team to create perfect world pathways. And this is a challenge because teams tend to get in a room and they start to limit themselves based on the real world that they are living in. So you'll need some innovators in the room to talk the team through what a perfect world would look like and how they can think outside the box. There will need to be new solutions implemented for your team to be successful in these kinds of models. So this exercise is where those new solutions come from. Now, of course, not all of these perfect world solutions that your team will want to add to the pathway will be possible. I've done this exercise with teams where they have come up with over 100 ideas that they wanted to add to the pathway. So then there will be, of course, an exercise where you'll have to limit what is critical to day one and the first phase of this, and then add things as you continue to grow your program. But they really need to think about things differently and need to think about how they can partner with team members that are not part of their typical day-to-day activity. So as you build this team and you're working on in this way, you'll want to make sure that you incorporate those post-acute partners that you plan to work on this project with you into these kinds of activities, because they have a different view and a different lens that they look from that will be highly valuable to your team as they're doing this work. So as I mentioned, as we started this practical tips section, it's really important that you build a foundation that you can utilize regardless of what payer is sponsoring your project, whether it be Medicare, Medicaid, a commercial payer, an employer, etc. You really want to be able to create scale quickly and use the work that the team is doing for other clinical areas. So for example, you do not want to build changes in a pathway that would only be applicable to a joint replacement patient. You want to build a foundation of work that you could easily translate over to a patient who is having spine surgery, for example. So build that foundation that you will be able to tap into as you evolve and scale this work and expand this work. So some of the things that there will stay the same that I want to point out for you to think on and focus in on as critical success components. Your continuing care network will be critical to your success. This is that network of post-acute partners that you will create and start to partner with to do things differently. So establishing that continuing care network of SNF providers, home health, community agencies, all the agencies that your patient may touch on this 90-day journey needs to be part of your continuing care network, and you need to start formalizing what that network looks like and how you can partner with them differently in a more successful way, and how you can start to have the same goals and objectives. So that's really important, that your team working in these value-based models does not have a different set of goals and objectives that your post-acute partners have for this one patient that you are all concerned about. It's really critical that you spend some time there. Another critical success component will be an integrated care coordination model. Again, care coordination is moving outside of the physician offices and the health systems and the other traditional places we've seen it. It's moving more into the community, and we have to think about how our model needs to grow and change to incorporate. A lot of providers have already expanded their care coordination roles outside of the hospital and the physician office. They've started to add some activity in the emergency room and in outpatient clinics, and we do have a lot of very impressive programs that are using community health workers across the country that are supporting these kinds of value-based care models. But the integration of your care coordination team and the ability for your care coordinators to be a team, regardless of where they are providing the service, will be critical to making this project work. Your care coordination solutions and your ability for your team to have visibility into the pathway and how, what are the goals, what are the action items that need to be completed, and what is the status, what does your timeline look like. So some sort of solution that allows this integrated care coordination team that we just talked about, could be all over the spectrum and all working with one person. How can you create some sort of visibility and solution so that they can all work on that same care plan together as a team in coordination with the physician and other champions that need to be involved? And then, of course, in all of these value-based care models, you will be receiving a tremendous amount of historical and current data and analytics. So, of course, thinking about your infrastructure for that, do you have expertise inside your organization to interpret that data, process that data, provide reporting that will be needed for your teams to be successful, is something that'll be critical to your success here that you should think about. These 4 building components, so I would say these are your pillars, these 4 things. If you can build these as your foundation, then every program that comes after your first one will be much easier to launch, as you'll have your foundation in place. So some tools to call out as you're looking at bundles and other value-based models. Be thinking about with your team, how will the program be designed? Who will be responsible? What will the pathways look like? Who will be accountable for this program inside your organization? And then operations, always a critical success factor as far as who are the operators, who day to day will wake up thinking about this program, who will be your champions to make change and innovate, realizing that you will have continuous improvement in these models. So this program will give you a lot of insights, and it'll give you pretty rapid feedback on what's successful and what's not successful. in your model. So remembering that this is not a static model, this is a change model, and your team that is focused here will have to make rapid change in order to be successful in their activity. And then, of course, making sure with any of these programs, regardless of the payer that you're engaged with, there will be compliance and governance that you need to think about and make sure you have very well covered, especially if you're planning to share any savings with someone outside your organization as far as partners. So just calling out some things that you guys are probably thinking about, but really make sure that you have this well covered. So some lessons learned as we move toward wrapping and giving you time for questions. These are lessons learned by the early adopters of value-based care programs across the country. And you heard in my introduction, I got the pleasure of working with the Catholic Health Initiatives team for several years. And some of these lessons are learned there and from other places, current clients that we work with as well. So a few things for you to think about that we have seen as teams start down this journey. As you decide where you want to focus your time and attention in this way, make sure that you have sufficient volume to spread out and manage your risk. So we've seen teams who have a really passionate goal to improve a clinical care area, but they have very few patients in that area. This kind of model does not lend itself well to a low volume clinical area, because you will not have the ability to spread out your risk if you have patients that do very well and then patients that do not do as well. So being able to have enough volume in the area that your team wants to focus on is important. I can't stress enough the organizational support for these kinds of models. Your leaders, your C-suite, if it's a physician practice, the physician owners of that practice, there needs to be a strong champion and a strong support for continuing to push these models. They're slow to get started typically, so you need a strong champion and committed champion to help you on this journey. I mentioned before about physician leadership and post-acute care. One thing we haven't talked about that I really want to stress that teams sometimes leave till last, so I wanted to call it out and encourage you to start with this on day one, is patient engagement. So on that team that I was mentioning where you would work as a team to plot out what happens on the typical journey and then how you can change that journey and make it the perfect journey, make sure a patient is there with you as you're redesigning. And be open and transparent and let them give you feedback. That will really be critical to have that perspective. I've seen teams design some excellent pathways without any patient engagement or input that did not succeed because it was not the right pathway for patients. So just keep that in mind as you develop your work. Of course, what we see typically, a lot of organizations will start out with bundles and then they will grow more into an accountable care or clinically integrated network type program where they then start to take on other risk programs, maybe Medicare shared savings or other payer risk contracts. The more you can integrate this work into other work that's happening in your organization. So if you have those kinds of activities already happening inside your organization, your ability to tap this program into that and share some of those foundational elements will be really critical and help you move faster. And then, of course, as you gain experience in these kinds of models of care, you'll start to have a proven track record that you can improve clinical outcomes and you also can reduce costs. And that will help you easily start to grow and expand in this area. Some of the alignment challenges that we see teams facing on a daily basis And then I want to draw out and mention a couple of things here just to highlight for you. We've mentioned some of these along the way. So make sure when you think about physician leadership, make sure you do not only include the specialist. So if you're working in a surgery area, include all of the providers that would be involved in that journey. So the primary care, maybe you use hospitalists at your organization, whatever physicians that will have a part there, anesthesiology, make sure that you're looping in the physicians that would have insights into that particular work that you're doing. I can't stress enough the need for a multidisciplinary team that includes the patient. So that patient engagement piece is really critical to make sure that you have the team you need. You really want to start transitioning away from one encounter and start to train your team to think more about this care continuum and more about the social determinants that are happening that might be influencing this 90-day journey. Those social determinants become much more critical as you start to plot out your success. Financial accountability, of course, key here. This is not a program that is free. We've already mentioned you'll have staffing implications, you'll have infrastructure implications. So what does that model look like? And how can you remain stable? How can you leverage other work that possibly could be shared here so the financial implications are not overwhelming? And again, how can you make sure that you're not just looking at the finances, but you're really striving to improve your quality metrics and your satisfaction metrics, not only with your patients, but with your providers as well. And then remembering that your C-suite leadership is typically not trained in these kinds of transformation value-based projects. They're trained much more in traditional healthcare areas. So the focus here to make sure that your leaders and your champions are clearly aligned and everybody has agreed upon where your team will be focused is important. So some practical tips as we move along here that I just want to stress, we've talked about these, that it's really useful to see bundled payment models foremost as care redesign opportunities, not just a financial model that is sponsored by a payer. So because of that, your success truly will reside in how you can reimagine the way that you deliver care. That's really critical and a practical area for you to focus time. You will have to create new relationships. There is no way to not create new relationships, and make sure as you're creating those relationships that you really partner with the partners that are committed to working in this kind of model, that really do see the value in doing things differently and looking toward the future. That's really important to pick the right partners. And within that outlook, just making sure that all of you and the team is really focused on one thing, which is to drive better costs and outcomes across the healthcare delivery system. I wanted to share this with you. I think this is an excellent way to describe how you can impact the patient care process. So the sources listed here, this research came from an article, Implications of Episode-Based Payment by Dobson, Devano, and others. And I wanted to share this with you, and it'll be in the materials, because this is the kind of thing that your teams need to sit down and accomplish. They really need to think about these different places in the journey that things need to be done differently, and then strategize how they would do that. This particular research, near and dear to my heart, talks about the success in using care navigation and care management throughout the journey and how this team did that successfully and achieved results. And so I encourage you to read the article where they focused on the transitions that we've been talking about today and how every time there was a transition, there was an opportunity that they could impact. And then they started to graphically plot that out. So I wanted to share this with you. I think it's excellent work and encourage you to go take a look at that. So as we wrap up here and start to close, the areas that we talked about in your key strategies are listed here, and all of these things, as I gave you more details as we went through the presentation today, are the areas that I would start with and really try not to overwhelm the team to solve for everything in this first pass. If they focus in on these areas and start to think about a different way of delivering care, they will be successful. So I wanted to share in closing some research that is out in the field that I think is important, and I hope there's some researchers on the line as well. The research so far specifically around bundles has really focused on whether these kinds of models can decrease costs without impacting quality. So this is the Innovation Center here. They published their research on hospitals that were participating in joint replacement. And what you see is that they did achieve cost savings as a result of this model, and they did not see any impacts to quality. And you see the quality indicators that they used were around unplanned readmissions, ED visits, post-discharge mortality. So that's truly, when the first BPCI program was developed, that was the Innovation Center goal. Can we decrease costs and not impact quality? So at Catholic Health Initiatives, we did research as well, trying to see the same thing. Were we able to see a difference in cost? And in that difference in cost, which we did see a significant difference, were we able to improve quality is what we were hoping for. And we focused in on readmissions, and we couldn't quite get there in our first research study to show that difference in readmissions that we would like to see. So what I would say is that the researchers are consistently, and so I challenge you as new, either new participants in this model or expert participants in this model, what we would love to see in this field, for those of us that are passionate about value-based care models, is our ability to decrease the cost and improve quality. So we actually see some significant statistical improvements in these metrics. And it's coming. I feel certain it's coming. And there's small research out there that's showing some of that positive momentum. We'd love to see more of that as we move toward more of these models. So as we close today, we talked very quickly and a lot of information about these models, about how you can use the work that you've already done in your organizations to build scale and achieve success quickly, and giving you some practical tips to be successful. So I hope I've answered a lot of your questions, but we do want to allow you time to ask questions. And so we are going to field some questions here, and then I'll make a commitment to you. If we don't get to your question, I will answer that question offline directly with you. So I'll turn it over to the team and we'll start some questions.
Thank you, Dr. Call, for that fantastic presentation. We will now begin today's question and answer session. Please submit any questions you have by typing them into your control panel in the space labeled "Enter a question for staff" and clicking send. We will try to get through as many questions as we have time for. There have been a lot of great audience questions, and the first one is, for those who opted to participate in the initial BPCI Advanced Initiative, when is the first opportunity to submit the data request for the data used to calculate preliminary target prices or historical Medicare claims data from CMS?
That is a great tactical question. I'm happy to provide that information. I have a cheat sheet on that. So if you'll log that question for me, I'll be glad to send that over for the participant that's asking that. We'll get that in your hands. No problem at all. We want you to have it soon. Everybody wants their data right away. It's very critical to your success. So I'll be happy to send that information over.
Thank you for clarifying that, Dr. Cole. The next question, and it looks like this is the last question we have time for, is what percentage of the 800 facilities participating in CMS bundled payment initiatives received gain sharing payments for meeting bundled payment costs and quality targets?
It's a great question. That is publicly available. I don't have it at my fingertips, but I'm happy again to get that answer. The transparent answer I'll give you is that we didn't see as many achieve as we feel can achieve in the program. And it seems like, I'll just add this commentary, as teams become more mature in the programs, we see that ability to achieve success turn very quickly. So it's not uncommon for the first several months, even a year in the program, for teams to not be as successful as we see them start to pick up speed and get their infrastructure and their care redesign models in place. We see a rapid improvement in the second year of the program. But that data is out there and available, and I'm happy to aggregate that and send it to whoever asked that question.
Great, that is helpful to understand. We actually have time for one more question. So, Dr. Cole, how do you encourage leadership to better understand goals with bundled payment models?
Yes, that's a great question. So I think with all leadership, physician leaders and other leaders as well, they have to have the ability to understand the program more clearly. So there's a lot of misunderstanding about the program itself and how you can achieve success and where the teams need to be focused. So I would say some of that is clarification of the models itself. But secondly, most leaders are much more confident in this program if you can attach your work in this area to existing strategies for the organization. That seems to be the most successful way to get quick buy-in. So if your strategic priority for this year is to decrease cost in a certain area, how can this model help you achieve that faster? How can your work in redesigning your pathway impact those kinds of strategies? And they can. You have to be intentional about plotting those out and attaching them to your organizational strategies. And once you can make that deliberate connection, the leadership support tends to rapidly increase and improve. Again, talking as we did today about not making this program, you don't want to put this program outside in a bubble by itself. You really want to integrate this into other work that's going on in the organization that will support other key strategies and initiatives. So for example, I know one team very successfully was having a very difficult time with penalties, specifically around readmission penalties around congestive heart failure. They attached this work to that area of concern for leadership, and they redesigned the way they were delivering care for CHF and then improved, of course, their results in all areas that impacted the organization and also achieved savings in this model. So those are some ideas of how to intentionally attach to what your organization is already focused and feels is important versus attaching yourself to an area that maybe there's a physician champion that feels like it is important, but it's not as important to some of your other key leaders. So I think that's a key tactic there that would be helpful.
Thank you for that informative response. That is all the time we have for today. I want to thank Dr. Cole for the excellent presentation and our audience for participating today. Enjoy the rest of your day, and we look forward to having you join us for future webinars.